fun of it. Welcome back to Inside South Florida. Dr. Jacob Steiger is a prominent facial plastic surgeon here in South Florida, and he's on our show right now to tell you all about the mental and physical benefits of getting some plastic surgery. All right, it's been a while since we've had you on the show. Dr. Steiger, welcome back.
Thanks. Good seeing you.
Good to see you as well. You went sort of like business casual. I like it.
Yeah, you know how it is.
All right, tell me about your practice and your office and what you guys do over there.
So, you know, as you know, I'm a facial plastic surgeon, so we do plastic surgery of the face and neck. Cosmetic, mainly, mostly cosmetic, a lot of nose jobs and facelifts and eyelid surgery, do the all the lasers. Last time we spoke about a new and exciting laser, that was 2 years ago. It's crazy, it feels like even longer, but so all the latest technology as it relates to plastic surgery of the face.
So being that you've done this now for a while, I mean, it's your profession. Are you ever fired up? Like someone comes in and they want to do something. Have you ever been like, I haven't done that in a while. That'll be a cool one.
You know, the answer is yes and no. Yes, in the sense fired up. I love what I do. I'm like, every day I wake up in the morning, I'm like up at 5:30. I'm amped up to like start surgery, go to work. I absolutely eat, breathe, sleep it. So I'm very fortunate. You know, it doesn't feel like work to me. So that's yes. I mean, my practice is I'm so focused on what I do. There are like, you know, just a handful of procedures I do day in, day out. So it's very rare that I do something that I've never done before. But I do things, you know, I have more challenging cases. I do a lot of revision surgery, especially with the nose. We fix a lot of, you know, bad nose jobs from the past, or nose jobs that didn't heal well. And so with those, it's always a challenge. You never know what you're going to find and what you're going to see or what you're going to have to do exactly. And so a lot of it is kind of an art form in that sense, and in the challenge of it, and figuring out. We have a game plan. We know most likely what we're going to have to do. Every now and then we have to call an audible, and things change a little bit, and that's why you go to a professional,
right. Yeah.
You know, because we can do that, and we do that commonly. So the answer is yes or no.
Do you get, being that it's South Florida and people are obviously very, I don't know, interested in what they look like around here.
Exactly.
There's a bit of like the shallow pool going on, but not even shallow, that's the wrong word. But I think people are, you know, cosmetically are very interested in how they look.
I mean, yeah, I think it's a reflection of our time too. We're not just in the world of plastic surgery is only for celebrities, weirdos, and like the taboo nature of it. It's over, man. I mean, people are doing plastic surgery, you know, hand over fist. They see the changes they can make, whether it be a nose job, a facelift, an eyelid surgery, the injections, the lip injections, the cheek, you know, all kinds of different things that it just people accept it. You know, we live in this social world with Facebook and Instagram, and people see celebrities who do things, and it's in their reach today. You know, it's very commonplace. Rarely do you know someone in South Florida, New York, any big city that has not had some kind of plastic. Like you have, I'm sure, plenty of friends that have had plastic surgery,
yeah.
And whether it be, you know, a breast augmentation or a nose job or, you know, anything. So
a lot of my guy friends have had breast augmentations. I know it's weird.
Yeah, it's all good, you know.
Yeah, no, but you're right, and you know, not to put on your psychology hat,
right.
But I think for confidence and ability to, you know, date and even be better at your career, right. And things like that. I mean, like you said, where maybe there used to be a stigma, now if you can do something to give you a better chance at feeling good about yourself.
Right. I mean, it's not just, you hit the nail on the head. It's not about just looking better. It's about feeling better. So the end goal is, yes, to look better and to enhance your look. But what is the real goal? The real goal is to give you more self-confidence, you know. I see it all the time in teenagers who have nose jobs. This girl comes in, or guy, for that matter, very commonly, they're shy, you know, in the consultation. They're a little quiet, and, you know, they come with their parent. Their parents are like, yeah, they really want this, but they might be a little bit more shy in front of me. They come back 3 months later for a follow-up visit, and I mean, it's like a different person. They have all this confidence. They're dressed differently. And the parents will tell me they're doing better in school. They're, you know, because it just gives them that self-confidence, and that is the best part of what I do. It really is. It's not just a vain thing, like you said. It's not a shallow thing. It's really healing someone's inside as much as you are their outside.
Okay, let's have a little fun. Do you ever get some bizarre requests? Like, do people come in and say, I want, you know, the J-Lo nose or whatever, and you're like, eh.
You know, again, like we said, plastic surgery is so common, especially with celebrities and social media, that I see people coming in showing me pictures of certain celebrities and saying they like their lips, or they like their cheeks, or they like their chin. So I did a chin implant a few weeks ago on a woman who saw a celebrity whose chin they loved, and she wanted a chin implant, you know, to change the proportions of her face, which looked great. So are they weird? I have had some weird requests that if they're really off the wall, you know, and I don't think they're reasonable, then I won't do it. Like,
so without naming names, obviously,
right.
But give me an example of someone has said something to you and you just said, I'm not doing that.
Well, you know, I had a younger person coming in wanting her cheeks lifted and enhanced, and they're already so full and so large that it'll just look unusual, you know. And I think it's more of an unrealistic expectation of what that would do. So that's really important, to being able to weed that out, because at the end of the day, we want the person to be happy with what we're doing, and me to be able to say, that's my work. I don't want people walking around and being embarrassed that it's something that I would do.
Right.
So you know, it's just about managing people's expectations, being realistic. You know, I've gotten a lot of strange requests. I'm kind of blanking on which one would be the weirdest request I've ever gotten. But you know, I've had someone wanting a more ethnic-looking nose. They had no hump and they wanted a hump on their nose. You know, that was an odd request for most people in our, you know,
Do you
Western
accommodate
world.
that?
You know what? That was actually a very reasonable request. She wanted actually a little bit of a fatter nose. She was African American, and a lot of African Americans come in. They want skinnier noses, more Western-looking, or Asians, more Western-looking noses. This person wanted. She actually had a nose job before, and it looked too Western. She wanted her old nose back, and I did accommodate that, and she was very happy.
Yeah, and I know that you do a lot of stuff on ears too, right? Like the different shape ears that stick out too far.
So that's a really cool procedure. We talk about self-confidence.
Yeah.
That's a procedure done on, you know, anybody in 5 years old up until, you know, I've done it on a 60-some-year-old a lawyer, and what's great about that is people, especially younger people, teenage years, they're really self-conscious about their ears that stick out. A lot of girls never wear their hair up in ponytails because of that. And so you do the surgery. They come in a week later in a ponytail, smiling. You know, they're wearing different clothes, different headbands. So absolutely, ear. It's called an otoplasty. Oto means ear. Plasty means change the shape of. So we're changing the shape of the ear, and it's a really cool procedure.
I feel like I could talk to you for another half hour.
Yeah.
We can't, unfortunately.
Okay.
But if people want to come talk to you and maybe get a consultation, how do they find you?
So my website is probably the easiest place to start. It's www.drsteiger.com, drsteiger.com, and that's a good starting place to see a lot. We showcase a lot of what we do on there, and the best place is to come in and meet me. So,
okay. Well, he's a great guy. Trust me. Dr. Steiger, always good to see you, man.
Thank you. Good seeing you.
Thank you, Dr.